Hi, Dr. Scott Davidoff with Mainline Spine, pain management physician, and I'm here to talk about PRP. PRP stands for platelet-rich plasma. This is a growing, popular procedure that's gaining more popularity within the pain management realm as a more homeopathic or natural source to help patients' pain. PRP stands for platelet-rich plasma. And essentially what that means is that in our bodies, within the blood, there's a protein called platelets that has a very high concentration of natural healing factors. So what PRP, or platelet-rich plasma, is an injection where we're able to utilize your body's natural healing factors to regenerate healthy tissue. The way this is done is that we do a simple blood draw, take your body's natural healing factors via blood draw, it goes into a machine, and that machine spins out the platelets. So we're left with a very high concentration of your body's natural healing factors. From there, we're able to localize that into an area of injury. Sometimes that's used with an ultrasound guidance, sometimes it's used with an X-ray guidance in order for us to really fine-tune and target the specific area of injury. There are multiple conditions that we've used this for in the past, and also a growing number of conditions that we're using it for currently and in the future. Some of the more common conditions that we use PRP to treat is shoulder pain, such as rotator cuff tears or tendinitis, patients with knee pain, again from osteoarthritis, or meniscal tears or certain ligament tears. We also commonly use it for tennis elbow, and more we're using it to treat chronic or semi-chronic low back pain. The way it works is that when you inject the platelets or the natural healing factors into an area of injury, it works to regenerate healthy tissue. This is in comparison to steroids or other anti-inflammatories, which lower inflammation. PRP actually increases inflammation. So when the platelets become activated into an area of injury, it creates inflammation into that area, which then kickstarts our body to regenerate healthy tissue. Over the course of time, the body is then able to regenerate healthy tissue in order to decrease pain and increase function. So again, people with rotator cuff tears in their shoulders, meniscal tears in the knee, degenerated discs in their lower back. When we inject the platelets, the platelet-rich plasma or the PRP into those areas of injury, the body regenerates healthy tissue. So if you think of a disc as like a jelly donut, they're the shock absorbers in our body. And over time, commonly, discs get torn or the donut gets pushed down or the jelly squirts out. And the platelets then activate that disc to regenerate healthy tissue. The disc height increases, the tear in the disc heals up, and essentially the shock absorber is now working better. So this then allows us to function better, sitting, standing, running, walking, getting back to activities of daily living or certain exercises with less pain and increased function. For years in our field, we've used it for athletes, whether it's to avoid surgery or during surgery or after surgery to help them heal. And we're now using it more and more for everyday individuals who have suffered from pain and either want to avoid surgery, have already had surgery, want to avoid more surgery, or want to avoid prescription medications. Maybe you've already completed physical therapy, done different steroid injections. And so this is a treatment that is very low risk with a high reward, again, using your body's natural healing factors to decrease pain and increase your function. So there's been multiple clinical trials in our field which have proven the efficacy and the low risk of this procedure. Anecdotally speaking, from my clinical practice, I've been using PRP for about 10, 15 years now. Again, we're using it more and more as time goes on, as more literature comes out, as we're living longer and want to become more active. We're seeing more and more patients that want this more natural or homeopathic therapy. Myself, I've used this in high school and college athletes. I've used this in labor workers or weekend warriors that hurt themselves playing basketball or baseball, want to continue, or just someone that's semi-active, but their shoulder, their knee, their back has been injured over time, and this has been a very effective treatment. Clinically speaking, I would say that over 75% of patients get 75% or more relief of this. Like everything in medicine, nothing's 100% and doesn't work for everybody. But I think that one of the take-home points here is that, again, because we're not using an outside medication, we're not this is not surgical, we're not implanting anything, that this is just using our body's natural healing factors to regenerate healthy tissue. So PRP, because it's working on the actual pathology to fix the problem without surgery or regenerate healthy tissue, this typically takes a little longer to get the full results than, say, an oral steroid or a corticosteroid injection. The way it works, when the platelets activate, we talked about before how this increases inflammation. So typically there's a little period where the pain can increase. This is typically not severe. You're up and about the next day. You're not laying in bed. There's no real recovery time. But as the platelets activate and the tissue regenerates, there's a period where some inflammation happens. That typically can last anywhere from 1 week to 3 weeks. Typically, it's guided by physicians about what physical therapy to do afterwards. Maybe you've already done physical therapy, what exercises to start back at home. So we'll help you guide your activity level afterwards. But the process can take anywhere, as I said, from weeks to months to get the full effect.